Hey everyone, how's it going? My name is Lance Fuller, and you may know me as the author of the hair transplant blog and YouTube channel, My Follicular Journey. Today I'm in Austin, Texas, and tomorrow I will actually be undergoing a follicular unit extraction procedure with Dr. Daniel McGrath here. And I just wanted to give you all, my viewers, an understanding of why I'm doing this third procedure and what you can learn from a professional, Dr. McGrath. So, Dr. McGrath, tell the audience a little bit about your practice and what you do here.
Well, our practice obviously is geared specifically around hair restoration surgery. It's what I've been doing for the past 14 years, and a good portion of our practice focuses as well on follicular unit extraction and doing follicular unit extraction cases. As a practice itself, though, it distinguishes itself from many other practices because there are some people out there that just do hair part-time, or maybe they do bellies on Monday and boobs on Tuesday, and then they might do one or two hair cases a month. Whereas myself and my colleagues, the people that I work with in the hair restoration industry, this is what we're completely dedicated to, is hair restoration surgery.
Gotcha.
So a lot of it is, of course, surgical, and then a good portion of it is a medical approach for hair loss issues as well. So.
Gotcha. And can you tell me a little bit about your background, what got you into hair transplants, and what kind of got you on this path?
Sure. Well, I had been doing a combination for many years of family practice and general surgery. My background and training was in general surgery. And I just had the good fortune a number of years ago to meet back up with an old colleague of mine who was doing nothing but hair restoration surgery and had been doing that since his days after our joint graduation from medical school. So it was just a chance encounter, and I had the golden opportunity to get trained by this surgeon, and it worked out. It was something I found that I really enjoyed, and it really sort of helped to invigorate my interest back in the surgical medical field, and it was really a second career, if you will, and it's been wonderful for the past 14 years. That's all I've done.